Namaskar दोस्तों, welcome to channel Toxicology on board. Today in this video we'll be discussing another important topic, that is characteristic of pyrethroid type 1 and type 2 compounds. So let's directly dive into the question. The question is the characteristics that distinguish a pyrethroid type 2 compounds from type 1 compounds. So we need to identify this type of pyrethroid type of insecticides. In that we have type 1 and type 2. What is the distinguished feature between type 1 and type 2, that we will see. So let's see the options, and this question is taken from recertification examination ABT, that is 2000 paper. Though nowadays the exam pattern is changed. Nowadays the questions are not five format questions, but five options questions. Four option type of questions are there, but still this particular concept is still part of the syllabus. So through this question, we'll try to read all the concepts related to this particular question. If you look into this ABT brochure also, today only ABT brochure new 2026 new brochure has been updated into the ABT website. So please go back and see. I will also go through and see what are the important changes are there. If any important changes are there, that I will upload in the channel. So as you can see, it is still a part of domain 3 risk assessment. Relevant toxic agents such as pesticides. So pyrethroid comes under pesticides, insecticide type of chemicals, class of chemicals. So the option is mammalian toxicity is manifested by paresthesias, presence of a cyano group in the carboxylic acid moiety of the molecule. Mammalian toxicity is manifested by breathing movement, difference in their relative potential to depolarize persistently and block conduction in the nerves. The right answer will be in the green text, that is option 1, option 2, and option 3. All three are the characteristics which will distinguish pyrethroid type 2 from the type 1 compounds. Okay, so you have to, these are the typical structures of type 1 as well as type 2 pyrethroid examples, okay, which are given in the Clayson textbook under figure 12. This will be there in the case of pesticide chapter. So you can see on the type 2 all cyanide groups are there. So that is one characteristic feature, presence of cyano group in the carboxylic acid. Paresthesias, you can see that you will have a breathing movement or pain in your fingers, okay. And mammalian toxicity is manifested by breathing movement, that is only called ethitosis. So we'll read about ethitosis more in the subsequent slides, okay. So first thing that we come across regarding pyrethroids in the Clayson textbook is it comes under mechanism of toxicity chapter. You can see on page number 31 there is a table given, table 3.1. This table 3.1 will discuss about the agents which are acting on signaling systems for neurotransmitters and causing dysregulation of momentary activity of electrically excitable cells such as neurons as well as muscle cells. So let's understand how pyrethroid is acting. So if you look into this table, pyrethroids are listed under voltage gated sodium channel. So the mechanism through which these pyrethroids are acting uh, is through they are interrupting this voltage gated sodium channel. How I will say, if you look into this particular typical, this is a neuron structure is there, no? You have axon, dendrite, body will be there. But in the case of axon, here this is the particular location. Here Na plus K plus ATPase pump will be there. Okay, across the cell membrane, you have positive ions on the other side, and inside will be negative charge. So because of the difference in the membrane potential, influx of sodium ions into the cell takes place. Efflux of 2 K plus ion will be taking place. Okay. In detail also we'll see one more diagram. I kept it in the next slide to understand. So if you look into this Na plus sodium gated channel, no, you have open state, inactive state, and whereas closed state. Okay. So whenever this open state will be there, sodium ion influx will be taking place. Okay. In the case of closed state, both the gates will be closed. But in the whenever we are using pyrethroids, no, this closed state, this is the particular state of the channel where pyrethroids will target. Here after the inactive state, the sodium and K plus pump has to be closed. But here what is happening? The it doesn't get closed, it remains open. As a result, excessive influx of sodium ions into the cell takes place. As a result, hyper excitability will be seen. So hope you are getting a little bit confused. We'll see in the next slide. Okay, this is the typical action potential. Okay. Um, Along with that, let's pause here and let's see what else other examples are given in this table 3.1. So along with pyrethroids, in this particular slide, we are seeing in this particular table that we have other examples like granulotoxin, which is coming from rhododendron species plant, bacteriotoxin, which is coming from particular this poison dart frog, and the scorpion toxin we have discussed in our channel in another videos. Cigua toxin also, last video was about Cigua toxin. Okay, so tetrodotoxin, which is coming from pufferfish, muotoxin, conotoxin, which is coming from cone snail, and other type of examples are there like quinidine, anti-convulsive drug like phenytoin. All these things, no, they are the examples where they are acting on voltage gated sodium channel, including here you can see DDT also. So DDT is also acting on voltage gated sodium channel. As a result, how I will explain, even mosquitoes, how they will die because of this membrane excitation taking place in their limbs actually. So pause here, read about because whenever you are reading, you have to integrate and read the example so that you will be able to eliminate the options in the question. Okay, let's see what other pages are there in the case of Clayson only. Page number 336, they have given two more tables. It is table 22.3 as well as table 22.5. So here again, you can see that pyrethroids, both type 1 and type 2, they are listed, and they are acting, the target is sodium channel, and what they are causing? They are causing activation. Here down you can see even DDT is also causing activation of the sodium channel. Okay, other examples are also, in addition to sodium channels, pyrethroids also target GABA receptor gated chloride channels. Okay, so this is very important table, that is 22.5. You keep coming across this 22.5 table because this, no, they have listed the classification of this pyrethroid insects based on the toxic signs in the case of rats. So we have type 1, that is T syndrome, and we have type 2, that is CS syndrome. Okay, so what are the signs that we come across with respect to type 1 are aggressive sparing, increased sensitivity to external stimuli, whole body tremors, and prostration. These are the symptoms for the type 1 type of T type of syndrome. Coming to type 2 syndrome, that is CS syndrome, we have pawing and burrowing. The rats will do pawing and burrowing, profuse salivation, coarse tremors, chorioethitosis. In the first slides also you have seen that chorioethitosis, the fingers will become like this, and clonic seizures. So you will keep getting this in your exam as well as question. So what is the characteristic symptom for type 2 type of CS syndrome? The answer will be clonic seizure. Okay, so pause here and try to remember the examples also. Sometimes without giving the classification, they might give you some examples also with respect to question. So we have type 1, under which we have allythrin, bioallythrin, resmethrin, as well phenolphthalein. Coming to type 2 CS syndrome, we have deltamethrin, we have phenavalerate, we have cypermethrin, as well as cyanoethrin. So in your exam, most or nowadays we'll come across cypermethrin, you'll come across deltamethrin, you'll be coming across, and allythrin. At least these three examples you try to remember. Sometimes you might get phenylalanine to confuse you. Okay, so we'll see what are the things which have been discussed under toxic effects of pesticides in a Clayton short textbook only. If you look into this pyrethrin, no, pyrethrins were first developed as insecticides. Okay, from the extract of the flower. This is the Chrysanthemum cinereifolium. This is the source from which this particular chemical, that is pyrethrin, has been extracted. So in ancient time also, if you look into the literature in China also, Persia also, these were still used. Okay, so why, what is the nature? Why? Because this, there should be some characteristic which, these pyrethrins, they will decompose rapidly on exposure to light. The synthetic pyrethroid analogs they developed. So because there are some drawbacks with respect to natural pyrethrins, so soon the chemistry people, scientists have realized that let's bring synthetic pyrethroids. So because of their high insecticidal potency, why, when compared to other insecticidals, still pyrethrins are having major role. Why? Because means they are having high insecticidal potency, means at low doses they are able to kill more number of insects, and relatively low mammalian toxicity. So since wherever you are applying this insecticides, no, it is in the vicinity of the human beings only, so it should be targeted, it should targeted kill only the insects but not the human being. So it should have low mammalian toxicity. Selective toxicity is very, very important. Lack of environmental persistence. This is also very important. It should not be like a DDT, which is lipophilic, which will be remain in the environment for a longer period of time. So it is having less persistence. Readily it gets degraded in the environment. So there is no bioaccumulation or biopersistence. That threat, that risk is not there by the use of this pyrethrin insecticides. Relatively low tendency to induce insect resistance. So that any individual, any organism, it is by nature that they will try to in order to survive, no, they will create some kind of alternations in their morphology to survive. So insects will also do the same thing, but when compared to pyrethrins, no, they are less resistant. Pyrethroids now account 15 to 20% of the global insecticide market currently. Okay, pyrethroids are widely used as insecticide in house as well as in agriculture. They have some applications in the medical field also. Okay, they are used for scabies and to kill head lice. Okay, um, now let us understand what is the mechanism, how the pyrethroids are acting on the insects. See, if you look into the pyrethroids, no, they will alter the normal function of the insect nerves by modifying the kinetics of this voltage sensitive sodium channel. As we discussed, no, this is the normal sodium channel, and this is one with the pyrethroids. So we have open stage, inactive stage, closed stage. Okay, once you apply the pyrethroid stage, the closed stage will not be closed, it will keep, the gates will be open. As a result, more number of sodium ion influx will be taking place. So insecticides, what they are doing, they are acting on the insect nerves by modifying the kinetics of this voltage sensitive sodium channel, which mediate the transient increase in the sodium permeability of the nerve membrane that underlies the nerve action potential. Okay, on absorption, these pyrethroids are very rapidly metabolized. Okay, so they will not be accumulated or retained in the body for a longer period of time. So two major biotransformation we have. One is hydrolysis of this ester linkage. If you, I have given the structures of this particular pyrethrin example, so ester linkage will be there, to which carboxyl group cyanide group will be there, which is catalyzed by the liver as well as plasma carboxy esterase, because COH group is there in that chemical. Okay, oxidation of this alcohol moiety by the CYP450 enzyme. So initial reactions are further supported by oxidation, hydrolysis, and conjugation. Okay, so we will see what are the signs and symptoms again in detail about the mechanism of action. Based on the toxic signs in the case of rats, we have type 1 and type 2, which we have discussed. Okay, and okay, so if you look into this type 1 compounds, no, they will produce syndrome consisting of marked behavior, arousal, aggressive, sparing, increased startle response, fine body tremor, progressing to the whole body, and protestation. That is type 1 type of syndrome. Okay, coming to type 2 syndrome, you have profuse salivation, coarse tremor progressing, chorioathetesis, that fingers will become a clonic seizures. Okay, so pyrethroids, they will develop disrupt this voltage gated sodium channel in the case of in mammals as well as in the case of insects. But mammals, they are less sensitive. Okay, more targeted towards the insects. Pyrethroids, they will bind to alpha subunit of sodium channel, slow the activation opening as well as rate of inactivation. Closing, it won't happen. Okay, leading to stable hyper excitability of the state will be taking place. The higher sensitivity of the insects to pyrethroid toxicity compared with mammals is believed to be result from combination of higher sensitivity of insect sodium channels, okay, lower body temperature, and slower biotransformation in the case of insects. These are the reasons for selective toxicity of these pyrethroids towards insects rather than mammals. Okay, so type 2 pyrethroids, they will bind to this. In addition to that, as we have seen in the table 3.1, no, in addition to sodium channel, they are also binding to GABA 8 chloride channels. Okay, okay, so thereby it will cause seizures. Okay, severe in case of type 2 type of poisoning. Okay, so what is happening in the case of occupational exposure? Those workers who are working with this particular pyrethroid insects, what is happening? How the nature is that? See, the primary adverse is that the exposure is through dermal contact only. Actually, frankly speaking, less toxic is there pyrethroids. But on chronic exposure, because in an occupational setting, daily the workers will be coming in dermal contact also with this particular chemical. The primary adverse effects result from dermal contact with pyrethroids is paresthesia. This is the thing. A tingling type of pain you will be having in your finger. Okay. Symptoms include tingling and pricking, or when more severe, burning sensation you will have in your limbs. The condition reverses within 24 hours. After the exposure, you wash it off or you get away from that particular exposed chemical, then you will be reversible type will be there. Topical application of vitamin E will also mitigate that risk. Okay. Due to why there is a paresthesia is because abnormal repetitive activity in the skin nerve terminus. So nerve endings, the nerve endings in the skin, hyperexcitability of the sodium current, because of which you will have this particular type of paresthesia. Chronic studies, they show that there is an increase in liver enlargement is there. Okay. And this has been accompanied by histopathological changes. Okay, there is less evidence of teratogenicity or mutagenicity. This shows that this chemicals is almost safer. Um, okay, there are some incidents where they have seen lymphoma in the case of rodents. They have seen. Okay, so this is the typical diagram which is given in the case of Clayson 9th edition textbook, page number 1072, explaining the mechanism. How this, see, this is the resting stage. Here the sodium channel is closed. Okay, this is the sodium current. Here it is open. This is a normal inactivated state, closed state, again closed resting state. And this is your sodium current. This is your action potential. Here you can see the tail, sodium current tail will be there. Whereas in the case of pyrethroid poisoning, sodium current tail will be longer. That we will see. One question with respect to this particular sodium current also they will be asking. Whereas in the case of pyrethroid, what is happening? This particular closed state, it remains closed. So more number of sodium ion influx is taking place. So pause here. Try to read about this particular thing very detailedly. They have explained it. Okay. So we will go to important things which have been discussed under class and CD summary. Okay. So important thing is that type 1 class lack the alpha cyno group, whereas in the case of type 2 classes, no cyno group is there. That's why I gave you that structure. In that, next to carboxylic group, COH group, you will be having cyanide group will be there. Okay. And important thing is that piperenol butoxide. CYP450s are more important in the detoxification. If P450 is inhibited by piperenol butoxide, the potency of the pyrite is enhanced. So whenever you are using pyrethroid insecticide along with this piperenol butoxide, no synergistic action is there. So always these formulations, if you see, you will have piperenol butoxide along with this either altimethrin or deltamethrin, like that. Okay. So pause here. Important CD summaries notes are there. These are repetitive thing only. We have discussed about T syndrome, CS syndrome. The same points are here. Okay. So in addition to this, no, I have kept this time some questions from the PK Gupta textbook are there. Very nice 2 to 3 books are there from this particular toxicologist, sir. So for your quick revision, I have kept this one. Describe the mechanism of action of pyrethrin and pyrethroid mechanism. Stoppage of this sodium channel closed because of its influx of more sodium. So that particular thing has been very clearly explained. Okay, and synergistic is piperenol butoxide. Describe the symptoms of pyrethroid poisoning. So we have seen main thing is you will have the muscle twitching, what a breathing. This one that at the uh, characteristic feature will be that muscle twitching, that you have to remember. Can we use phenothiazine derivatives as a treatment in pyrethroid insect poisoning? No. Why? Because it is contraindicated when it is used along with the pyrethroid insecticide. So one question with respect to this also they'll ask you in exam. What are the pyrethrins and pyrethroid insects? So don't get confused. What is pyrethrin, synthetic one? What are pyrethroid insects? Do a comparison. The source you will be able to understand. Okay, read here. Next, we have a few more questions are there from the same series of textbook. 2 to 3 textbooks are there. Illustrative toxicology or some textbooks are there from this particular author. Describe the important properties of pyrethrins and pyrethroid insects. Very important. In order to understand the nature of the certain chemical and its use, you need to know the physicochemical properties. So as we have seen that these compounds are more persistent. Who pyrethrins have greater insecticidal activity, photostable, low dose are effective, and have low mammalian toxicity, selective toxicity. Then we have classify pyrethroids. So you should know type 1 and type 2. Which pesticides are commonly used for malicious poisoning? Pause here. Again, you see, we are keep discussing in our channel also, and it will be there in your syllabus as well as in your exam. Organophosphorus insecticides. You have to remember all the examples, the mechanism, how they're inhibiting cholinergic transmission. Carbamates also. You have to remember about aging, NTE, as well as OPIND, that is organophosphate induced neuropathy. Okay, then rodenticide. You should remember about examples: warfarin, coagulant, anticoagulant drugs acting as rodenticide. Then you have to remember fumigants such as aluminium phosphide and zinc phosphide. With this, no, you have to remember that whenever this zinc phosphide or aluminium phosphide, no, phosphorus is unstable, so it will be either in the form of this aluminium salt or zinc salt. But once it is going into your body, because of the HCl present in our stomach, this phosphide will immediately convert into a very dangerous gas, that is phosphine pH3. So it has some adverse effects. So like that you have to co-integrate and read. And last one is pyrethroid insects. The video is completely about pyrethroid insects. Okay, so in the textbook only some fill the blank, some true or false statements are there, so I compiled all this one so that it will be easy for you people to quickly revise it. So we have: the mode of action of pyrethroid insect is mediated through sodium channels. Type 2 pyrethroid insects differ from type 1 compounds in the presence of cyano group. A distinguishable feature of type 2 pyrethroid insects in rats is the presence of clonic seizures, which you see only in the case of type 2. Piperenal butoxide, we have seen it act as a synergistic. Okay, and diagnostic feature of chronic pyrethroid toxicity is muscle twitching. Muscle twitching के place में some other table ethetosis, like that you have to remember that example. Okay, so, which of the following statement is true regarding pyrethroid and pyrethroids? Once you understand the difference between, then you will be able to answer the exam. Pyrethrins and pyrethroids are rapidly hydrolyzed and metabolized, with majorly being eliminated within 12 to 24 hours. Main mechanism of pyrethroid ester toxicity is causing hyperexcitability of membrane by interfering with the sodium transport. Which of the following insecticides are more specific to arthropods, means selective towards cockroaches? The answer is pyrethroids. Why? Because LD50 of pyrethroids, if you see, lethal dose of pyrethroids for the insects is 1, whereas in the case of mammals it is 4500. Because of which reason the answer is pyrethroids. Okay. So similarly, some important statements from the same textbook I have kept you for you people. As we were discussing about the sodium current, in type 2 pyrethroid toxicity, characteristic tail is seen in depolarization phase of action potential. So in the sodium current, you see extend the tail will be there, no? The characteristic tail you can see in the case of type 2 pyrethroid toxicity. So I have given that table, that graph. To type 1 is showing different type of tail, sodium current tail, and type 2. So lengthy tail you can see in the case of type 2. Type 2 pyrethroids act as inhibitors for GABA. So certain times, not only about sodium current, if the mechanism option is with respect to GABA, then you have to remember that also. Okay. Type 1 pyrethroid toxicity are referred to as T syndrome, whereas type 2 it is called CS syndrome. C is nothing but chorioethetosis because of this finger and salivation, profuse salivation, excessive salivation. Contraindicated with pyrethroid poisoning is phenothiazine. Deltamethrin is example for type 2. Chrysanthemum is a source for this pyrethroid insecticide. Synthetic pyrethroids are less toxic and rapidly they are biodegradable. Okay. So some examples are also there. So next time when you go, you can check your mosquito repellents. You can check what is a particular insecticide present. Most of the time, cypermethrin I come across. It will be there in these examples. So natural pyrethrins examples are there. Type 2 examples are there. Important thing again. So first commercially available pyrethroid used till date is alethrin. That also you have to remember. Relationship between toxicity of pyrethroids and temperature. As the temperature decreases, the toxicity increases of this particular pyrethroid toxicity increases. So there is an inverse relationship between the temperature as well as the action of this particular insecticides. Okay. So pyrethroid cause CNS stimulation through inhibition of closure of voltage gated sodium channel. This leads to increased influx of sodium that leads to prolonged depolarization. So the cells will remain in the depolarization state. In mammalian species, pyrethroids are less toxic and fishes are more susceptible to this particular class of insecticides. So in addition to that, no, I have also this time I have accumulated 2 to 3 questions from another particular thing, that is America Academy of Chemical Sciences, AACT. Those people who are going through, they have a question of day. So every day, every day, question of the day will be there in this particular site. So from this I have taken. So this question is from 2018 paper. So total release foggers, sometimes called bug bombs. So these particular things are there, no? In the US it is called bug bomb. Bug bombs are pesticide products designed to fill an area with an insecticide, and often are used in homes and workplaces. Okay, to kill cockroaches, fleas, insecticides, flying insects. Which chemical do most TRF contain, and those pose potential hazard to users? So we need to identify the composition of a major ingredient which is present in this particular total release foggers or bug bombs. The answer is pyrethrin. Most TRFs contain pyrethroid, pyrethrin are both as active ingredients. Okay, TRF also contains flammable aerosol propellants that can cause fire and explosion. So they have given the reference also. You can go back and check that reference. So another question is also taken from America Academy of Chemical Sciences. Question of the day. So this question is from 2014 year. What is the difference between pyrethrin and pyrethroids? So in our video we have already discussed all the differences. Important thing you remember, more than 1,000 synthetic pyrethroids have been developed, but less than dozen of them are currently used in the US market. Okay, permethrin is the most commonly and frequently used currently in the US as per this particular reference. Okay, next we have another question which was given in 2013. Which is the chemical sometimes added to pyrethrin insecticide to increase efficacy? So we need to understand synergistic activity. Example was piperenol butoxide is sometimes added to synergistic uh, synergize pyrethrin. So you can see even in American Academy of Clinical Sciences also, whatever we have learned in the from the textbook are there, same questions are there, because concept once we read, question might come in either way, we will be able to eliminate the options and try to give the answer. Okay, hope from this video you were able to learn about pyrethrin, chrysanthemum flowers. Okay, which is the source, and type 1 and type 2, important thing, breathing movement of ethitosis. Okay, and piperenol butoxide synergist action. And thank you so much. Be curious. For any questions you can always write a mail to arya.priyanka18@gmail.com. All the best for your exam.